It's Ovarian Cancer Awareness Month, and I thought it would be apropos to give a talk on ovarian cancer. And by the time I finish this talk, I hope you will understand what the risk factors are of ovarian cancer, what the symptoms are, how we make a diagnosis of ovarian cancer, and how you ladies can prevent yourselves from getting it. I lost your picture again. Can you see me?
We can see you. I'm just, yeah, just
Okay.
keep going.
Ovarian cancer is the most deadly of all the gynecological cancers. 22,000 ladies this year will be told that they have ovarian cancer, and 14,000 women will die of it. That's about 65%. And the reason why they die of it, it's picked up in late stages, in stage 3 or stage 4, which means it's no longer in the fallopian tube or ovary. It's in your lymph nodes or in your abdominal cavity or even in your lungs. Now, the average age of ovarian cancer, it's usually a menopausal disease. The average age is in the 60s. And the survival, if you have stage 3 or stage 4, can be 20% or less. That means that 80% of women can expire from it. Now, there are various theories why it occurs. We have in our body 30 trillion cells in our body. And what these cells do every day is they're growing, proliferating, and dividing. There are 40 million cell divisions a second, and in each cell you have 20,000 genes. If one gene spontaneously mutates into a cancer gene, it changes a cell into a cancer cell. And when this cell divides, it makes 2 more cancer cells. And when those 2 cells divide, there are 4 more, et cetera, et cetera. And there are 40 million cell divisions a second. That's called a spontaneous mutation. That occurs 80% of the times in ovarian cancer. 20% of the times, you can inherit from your mom or dad a gene mutation. The most common ones are the BRCA gene mutations, BRCA1 gene mutation and BRCA2 gene mutation. We all have the BRCA genes in our cells. What they are tumor suppressor cells. But when they mutate, they increase your risk of breast cancer and ovarian cancer. I lost your picture. Can you still see me?
I can see you. We can see you and hear you. You can just keep going. Don't worry about us.
Now, why do spontaneous mutations occur in women? What are some of the theories why they occur and cause ovarian cancer? Well, one is, instead of your menstrual blood coming out through your vagina, it backs up through your fallopian tubes and causes an inflammation of the fallopian tube or ovary. Another one is that if you've never had any children, you have multiple ovulations, and this is a trauma to your ovary. Another can be you've had a tubal inflammation in your lifetime. And another one could be you're overweight or obese. Those are chronic inflammatory conditions. And the last condition is if you have endometriosis of your ovary, that can cause a spontaneous mutation and cause ovarian cancer. The major inherited mutations would be the BRCA gene 1 and BRCA gene 2 mutations, or the Lynch syndrome mutations. Now, what are the risk factors for ovarian cancer? One of the major risk factors for women is being older. I had said it mostly occurs in menopausal women. Another factor would be being overweight or obese. Those are chronic inflammatory conditions. Another condition is never having a child or having one in later life. You've had multiple ovulations, which traumatizes your ovary. Another condition would be having endometriosis. Another condition is having a family history of breast cancer, ovarian cancer, colorectal cancer. Another condition is if you're an Ashkenazi Jew, you stand a 1 out of 40% chance of having the BRCA gene mutations. Now, we think it starts in the fallopian tube, at the outer end of the fallopian tube, but it can occur in the ovaries in those women who have had endometriosis of their ovaries. Now, how do we make the diagnosis? It's simple. By you understanding what the symptoms are. The most easiest way for you to make a diagnosis that you have it is by remembering the symptoms that you may have. But you have to remember, these symptoms are not specific. The most common symptoms that we see in ladies who have ovarian cancer are abdominal discomfort or abdominal pain, pelvic discomfort, excuse me, or pelvic pain, bloating, feeling full all the time, or your abdomen increases in size for no reason, or you have symptoms of urinary urgency. You always have the symptom that you have to go to the bathroom. But remember, symptoms usually don't occur in early ovarian cancer. And these symptoms have to be present 12 days a month for at least 1 month. Now, what should your gynecologist do if you have these symptoms? Well, he should ask you about these symptoms. Secondly, he should ask your past history. How many children have you had? If you haven't had any, that's a risk factor. Have you had endometriosis? Have you had a tubal inflammation? Have you had breast cancer? Most women don't know breast cancer is a risk factor. A history of breast cancer is a risk factor for ovarian cancer. Have you been on hormonal therapy for menopause? By that I mean estrogen and progesterone. Some studies show it does. The Women's Healthcare Initiative did not show it. And lastly, are you an Ashkenazi Jew? The doctor should ask you that. Then what the gynecologist should do is check your abdomen. Do you have any abdominal pain? Do you have a fluid wave if you have these symptoms? You have to remember this when he does a pelvic examination. You ladies who are not menopausal, your ovaries are the size of a walnut with a shell. When you're menopausal, your ovaries are the size of an almond. If you're slightly overweight or obese, there's no way that I can feel your ovaries. So pelvic exams are not very accurate to pick up ovarian cancer. They're not very accurate. So in our practice, if you're menopausal and we can't feel your ovaries, we do a transvaginal ultrasound. And if you're overweight or obese and you're not my patient, you should tell your doctor, if you're menopausal, that you should have a pelvic ultrasound. Now, when we do a pelvic ultrasound, what our sonographer looks for, not only your uterus and the lining of your uterus, but she looks at your ovaries to see, one, how large they are. Two, are there any cysts or solid masses in your ovaries? She looks, what type of blood vessels? Do you have normal blood vessels or abnormal blood vessels in your ovaries? She also looks for any fluid in behind your uterus or in your pelvis. Sometimes we might order a blood test. I might have ordered on some of my patients that are watching a CA-125. That's a non-specific test for ovarian cancer. And in 50% of women who are in early ovarian cancer, it's negative. And it can be positive in benign conditions such as endometriosis or fibroid. So it's not a great test to pick up ovarian cancer. But if we have any abnormality on pelvic exam or on sonogram or CA-125, we always send you to a gynecological oncologist. We gynecologists should not be operating on cases of this type, and all the societies I belong to recommend this. Now, women ask me, can this disease, deadly disease, be prevented? I say yes. Whether you're menopausal or not, you should maintain a healthy body weight, and you can do that by taking my advice and Googling the Mediterranean diet. It's a diet high in vegetables, fruits, cheese, olive oil, low fat, dairy, milk, yogurt, cheese, nuts, fish, red meat, once a week, but in small portions. In our household, we eat 3 to 4 ounces of red meat a week, no more than that. Secondly, you must all exercise a minimum of 150 minutes to 300 minutes a week. I spin, I lift weights, I play tennis. You must be active. You have to try to maintain a healthy body weight. If you're overweight or obese, that's a chronic inflammatory state. That's why people who are overweight or obese die from COVID. You have COVID and inflammation, plus your body is in inflammation. Secondly, if you're a young lady and you're on birth control pills to stop ovulation, you stop your ovary from being traumatized. If you take a birth control pill for 5 years, you reduce your risk over 30 years by 50% of developing ovarian cancer. When you become pregnant after you have the baby, breastfeed. It stops ovulation. It reduces your risk of not only ovarian cancer, but breast cancer. Lastly, if you're having a cesarean section and you're finished with childbearing, have them tie your fallopian tubes. You stop that retrograde menstruation, the blood backing up from your uterus going to your fallopian tubes and ovaries. And lastly, if you have a family history of ovarian cancer, breast cancer, colorectal cancer, in our practice, we send you for genetic counseling to look for, they do a multi-gene study, and they check you for the BRCA1, BRCA2 gene mutation. If you have the BRCA gene mutation and we remove your tubes and ovaries, it reduces your risk of ovarian cancer and tubal cancer by 80% and reduces your risk of breast cancer by 50%. And if you're having a hysterectomy and they're not removing your ovaries, they should remove both your fallopian tubes, because we think ovarian cancer starts at the outer edge of the fallopian tube. Now, there's been a lot of talk that ovarian cancer was due to talcum powder. Some studies show it does, some studies have not shown it. The Women's Healthcare Initiative did not show that. The takeaway point is, 1, whether you're menopausal or not, maintain a healthy body weight, Mediterranean diet, try to exercise daily, go for a walk. Secondly, when you go to your gynecologist and if you're overweight or obese, especially if you're menopausal, insist on a transvaginal ultrasound. If we can pick up stage 1 and 2, that's ovarian cancer, that's in your tubes or ovaries, but not beyond your tubes and ovaries, your life can be saved. That's it. Any questions? Teresa? Hello?
Yeah, I'm here. Very interesting. So you said that women should ask their gynecologist to do a transvaginal ultrasound if they are menopausal.
Now, if you have breast cancer and you're not menopausal, absolutely, the gynecologist should be doing a pelvic exam, and you should be sent, if you have breast cancer, for genetic counseling. That's it.
Have there been any new advances in treatment of ovarian cancer?
They have with chemotherapy and surgery, but if stage 3 and 4, the mortality is so high, the 5-year survival rate is 20%. The major pitch should be try to pick it up a little bit early. So if you have those symptoms, please let your gynecologist know. If you have a family history of ovarian, breast, colorectal cancer, ask to see a genetic counselor. If you have a history of endometriosis, your doctor should be doing pelvic ultrasounds on you.
Is cervical cancer related to those cancers that you mentioned?
Cervical cancer is related to the HPV virus, which is sexually transmitted. This program will be videotaped for those of you who want to watch it again. Also, for those of you who are not my patient, we do gynecological consultations over the internet. We do DoxyMe, and we do them over the phone if you have any questions.
Any questions from the audience? You can unmute yourself, or you can put something in the chat and I'd be happy to read it to Dr. Bonura if you don't want to speak. We'll give that just about a minute. If anybody has any questions they'd like to put into the chat, comments or concerns. We've got a quiet group tonight.
Lastly, ladies, those of you who are not my patients, last month we did a video which could be very helpful. How you, your sister, your mother, your daughter can prevent yourselves and them from ever getting a urinary tract infection, especially bladder infections. They can be prevented, especially if you're the kind of lady that's had 2 in the past 6 months or 3 in the past year.
Oh, the recording, yes, Ruth Ann, will be on Dr. Bonura's website. Yep, we will post it on the website.
If that's it, so that's a wrap, as they say in Hollywood. That's a wrap. Good night, ladies.
Thank you.